Okay, so we're going to apply the applicator now. And so I'm just laying in a bed, and we have a whole room devoted to doing cool sculpting here. We actually have 2 machines, so we can treat 2 areas at once if we wanted to. Tricia is putting this cold pad on the area that we treat. This pad, it's a gelatin, and it protects the skin. So this is applied first, and it's cold, and that may be kind of one of the worst things. The treatment is putting this cold thing on there. So Tricia's now going to apply the applicator. So that's the applicator there, and you can see there's a little cup, and cool sculpting works by vacuuming up the tissue. Okay, so there's a little suction hose in here. So she's going to apply it, and I'll let her go ahead and do that.
Okay, here we go.
Right.
So for right now, I'm just going to turn the vacuum on and make sure I have a secure fit before actually turning on the cool sculpting treatment.
So one of the necessary requirements is that you have enough fat to actually be able to vacuum it up. So when Tricia evaluated me, she kind of pinched, and that's one of the things we would do during a consultation is kind of go around and see if it's we call it pinchable. So basically the machine has vacuumed up my fat into this applicator, and in a moment it's going to get real cold, and then we're going to start to freeze the fat, and we'll talk about that in a bit. So treatment itself, how long, Tricia?
It's a 35-minute
35-minute
treatment.
treatment for this area. So we're going to freeze this fatty tissue for 45 minutes. And she's basically getting the applicator set here so it doesn't move. And that's why we're kind of hiding it under the sheets here. And she's put towels around it to kind of hold it in place. So it's getting cold, and it's not painful, but it gets real cold. And it's kind of like if you have your hand on a block of ice or something for a long time, it gets real cold, and then it actually kind of numbs up. So it's not an uncomfortable treatment. This is, I think, the 3rd treatment I've had down here, 2nd or 3rd. In the previous times, I actually dozed off, so it's not a painful thing. We have people bring in computers, iPads, books, so you can read along while you're doing this. It's not a comfortable treatment. So the beauty of cool sculpting is that it is non-surgical and it does not require anesthesia. So right now, it just feels cold. It's not painful at all. So it's not something that requires anesthesia. The other beauty of this process is that it has a really easy recovery. So it's a little before lunchtime. I'm actually going to do surgery later on. We have some surgery planned, I think at 1 or 1:30, so we're actually going to progress with a normal day. And we have people have this done and they go right back to work, right back to normal social functions. You can get back into normal activities. You can resume exercising and that sort of thing right away. So that's the beauty of this process. Cool sculpting's evolved. We've had it for 6 years, I think.
6 years.
It's evolved. The treatment times have shortened, so it's a little easier than it was in the past. So now with treatment times of 35 minutes, we can treat a number of areas at the same setting. We have 2 machines, so if we wanted to, we could treat another area that was accessible, like the leg or the arm or the chest or something at the same time if we wanted to. Today we're just going to treat the the lower abdomen. I am going to require a second treatment on the right side. I think everybody saw the marking on the left side. There's not enough room to put the applicator in there right away, so we'll wait and do that when the left side's done. Afterwards, so what to expect afterwards, there's a little bit of swelling. Certainly not enough that's really noticeable. Clothing might be a little red for an hour or two. It might feel a little sore, like if you press, you might feel like you have a little bruise there. It's not anything that requires anything more than Tylenol or Motrin or anything along those lines. So it's certainly not a painful recovery. I'll get back into normal activities again. Surgery this afternoon. I work out with a personal trainer, and I think I have an appointment with him on Thursday. So I'm going to keep that appointment. There's no reason to not do that. And again, our surgery, our work schedule will be really normal, basically. So that's the beauty of coolsculpting. What's the downside of coolsculpting? It treats an area about that big. So for folks who need a lot of areas treated, again, more difficult because you're treating an area about that big. So what we try to do is just kind of focus on one or two areas to kind of get those maximized and then move on to new areas. So for folks who have a number of areas, then it might make sense to consider liposuction. That's really an alternative to this. This is a procedure that reduces fatty tissue, and the alternative is surgery, liposuction. So how does it work? It works by freezing the fatty tissue. So right now it's so cold there that the fatty tissue is being injured. The skin over top recovers, so it'll be a little red, but it recovers and is unharmed. But the fatty tissue below is harmed, and what happens is the body's own reparative process will go in there and actually remove some of that fatty tissue. So it's a natural process. Our cells are constantly being turned over and revitalized, and by injuring these fatty tissues, the body's normal system goes in and removes those injured fat cells. But the nice thing is they won't get replaced. So it's a way we can reduce fatty tissue non-surgically. Studies have shown that it reduces fatty tissue between 20 and 25%. So we'll expect the area to go down again 20 to 25%. Is it going to remove all the fatty tissue there? No, but again, a reduction. So some people might require more than one treatment. And again, this is my third treatment over, I think, 5 or 6 years. So very common to treat an area more than once. On average, people, 2 treatments?
2 treatments,
right.
Typically in a specified area of concern. And as long as you're maintaining your current weight, the results will last long term because the fat cell reduction is permanent. But you still have fat cells in that area, so if you were to gain 15 or 20 pounds, you can still gain weight in that area, but hopefully not to the severity of what it once was. So sometimes with changes of life, you might just have to come back later on, a few years after, just to have it treated again.
So it's been on, how long has it been on?
7 minutes.
All right, 7 minutes. It feels cold. It's certainly very comfortable, and I could, again, catch up on work or go on an iPad and surf the internet or read or something. So it's not an uncomfortable process at all. So basically, we're going to give this to about 35 minutes and then take it off. And so I think we'll take a little break and we'll show everybody what it looks like when it comes off.